Hi and welcome to this video where I'm gonna explain and describe how the ultrasound diagnostic scan works for the knee joint. So the knee joint, this is the knee joint, and one of the benefits of ultrasound that you can take a look at movement and dynamic visibility of tendons and tissue structures. So for example, when we want to see what's going on with the knee and when we want to check for any swelling, we use the ultrasound to take a look. Because like, oh, my knee is swollen, and I don't know why. I just had a run or a hike. I started feeling swelling in my knee, starts to feel stiff. So one of the ultrasound views, and this is the probe that we use, it's a Philips machine. It's very, very effective, high technology. So we put the probe on the knee joint right here. So this is a quad tendon. We take a look underneath the quad tendon because there is a bursa. So if you don't know what is a bursa is a fluid sac that helps to separate between tendon and joint to provide lubrication and cushioning for the tissue, for the soft tissue. So the bursa can be swollen or inflamed due to overuse. So if you did an exercise or an activity more than what you can tolerate, or you overdid it based on your functional level. Let's say you only used to walk 5 miles and you did a 15-mile walk. So you have a good chance that you might inflame some of the tissue structures in your knee, including the bursa. So with the ultrasound, we can place it right here. This is the right knee. This is an ultrasound. We put it on top of the quad tendon and we take a look underneath the quad tendon and see if the bursa is inflamed. It's very easy to detect. Also, through this view, I can detect any structural damage to the quad tendon. We take a look at it in this way. Also, we take a look at it in that way. So I have two views of the quad tendon in this case. One more thing I like to talk about is the medial meniscus. It's a very common injury. It can be due to trauma, sometimes not due to trauma. It can happen on its own due to overuse or overload of the knee. So another way we can take a look at your medial meniscus is ultrasound, not just MRI. You can also use ultrasound to take a look at it. So this is a medial meniscus. You can see it right here. This is in the blue color. Okay. You place a probe right here. So as you can see, there's also a ligament here. So that also is examined with ultrasound. So in one view, I'm able to take a look at your MCL, medial collateral ligament of the knee, and the medial meniscus. And if there is a tear or swelling, I can also detect that. Okay. One more view that I really appreciate about ultrasound is to take a look at the articular cartilage of the knee. Articular cartilage of the knee is different than the meniscus, because the cartilage is where arthritis happens. The wear and tear of the knee happens primarily in arthritis in the articular cartilage. So we have the patient bend their knee and we can place the probe here and we can take a look inside at the articular cartilage. Okay, if there is arthritis, we're able to detect it. Okay, last but not least, a lot of people know about it and it's called Baker's cyst. So what is Baker's cyst? As you can see, knee joint is very tight joint. It's not so much space inside of the joint. Unlike other joints like hip or shoulder or even ankle, the space that is inside of the joint is very limited. So when there's swelling happens between the joint surfaces. Okay, so this is the femur, the thigh bone, tibia, the shin bone, and they meet together at the knee. If there is swelling in between, then that swelling escapes into something called Baker's cyst. Okay, with ultrasound, we can also detect that by taking a look at the back of the knee. Another thing that we rule out during the knee, it's not a diagnosis. We're not diagnosing it, but we're able to rule out if there is any DVT, any occlusion of the popliteal vein, if there is any blood clot, in other words. That's not a diagnosis, but we're able to screen patients. So it's very, very important to know the swelling is not caused due to a blood clot. Okay, so we take a look at the back of the knee and we check for arthritis, we check for swelling, and we rule out or rule in DVT, deep venous thrombosis, a blood clot. And luckily we don't see that often, but we do it as a part of our screening. And thank you for watching.